Carrying on from what we just heard a lot about with Denise and Campbell's, which is changing demographics and market trends, we're going to have a panel discussion. Now, I want to tell you something. Okay, I'm a lawyer. You know that. Okay, fine. I got out of law school, and I went to another law school, NYU's tax program, so I got a master's in tax. Okay, that's fine. But Barbara Fowler, who is a senior marketing officer, went that same route, which is like, wow. So Barbara went to law school. She went to college. She went to law school. She got a master's in tax from NYU. And then she became a leader in marketing. So it's worth hearing a little about because I'm just getting familiar with it, okay? But chief outsiders. So not to do a pitch for you, Barbara, but it's interesting because you have a small company and marketing is key, but you don't have the budget or the need for a full-time marketing officer. How do you do that? How do you get a professional some of the time? Well, Barbara's firm, Chief Outsiders, is doing that, and she's leading the Northeast for the firm, and she's gotten very involved with ACG, which is very much appreciated, and she is going to lead our panel discussion right now. So come on up, Barbara.
I can always use a plug. And as my panelists come up, I did want to say that if any of you haven't used this new Goldfish My Way, it's so much fun. For Christmas, my dogs always have a couple goldfish with my husband every night. So I went to the Goldfish My Way site, and I got all the dogs' pictures, and I put it on the goldfish container. They shipped it to my house, and for the Christmas stocking, my husband got personalized goldfish from his pups. So he was very happy with that, and so were the pups. Okay, bringing the panel up, we've got Ken Bateman, who's the president and CEO of Somerset Medical Center. Ken? And then they're going to introduce themselves in a minute. And then we've got Lisa Hirsh, president and CEO of Accurate Box Company. Where's Lisa? Okay, come on, Lisa. We've got David Lewis, who's the president of R4 Inc. That's a company that helps war fighters and first responders, David Lewis. And finally, in the role of Betty Manetta, we have Ray Moya, who's the CTO of Argent and the CEO of Argent Pro. Ray had to come today at the last moment because Betty is stuck in Texas where all the planes were canceled because of high winds, and now that storm is coming up here. So I'm very pleased that Ray was able to come at the last moment. Okay, could you put your name tags right in front of you? Okay. So our panel today, we've got a couple of prepared questions, and then we're going to open it up to questions in the room. And first, I would like each member of the panelists, or each member of the panel, to just tell a little bit about their role in the company. And then if there was an insight or something remarkable that they heard from Denise, to just remark a little bit on that. So why don't we start with Ken? Ken?
Okay, great. Hi, I'm Ken Bateman, and I'm the president and CEO for Somerset Medical Center. So some of you may have had the experience of being at Somerset Medical Center at one time or another. I've been at Somerset now for about 12 years, and I've been their CEO for 8.5 years. I came into Somerset as CFO. Most of my career has been spent in the healthcare industry. My background is finance. I worked for KPMG, left KPMG as an audit manager. During my period at KPMG, I audited pretty much all hospitals. And I've spent time at Campbell Medical Center in Lakewood, JFK Medical Center in Edison, and now Somerset Medical Center in Somerville. So in terms of Denise, you know, one comment that I thought really hit home for the healthcare industry is when she said, you know, you need to recognize consumer shifts and market shifts. And I think the shifts in healthcare are seismic. That's all everybody talks about anymore, is controlling the cost of healthcare and entitlement reform. So in some of our comments, I'll share a little bit more of my thoughts on that. Thank you.
Thank you. Lisa?
Lisa Hirsh, president of Accurate Box Company. We're a third-generation family-owned business. We make high graphics corrugated packaging, which is basically the printed boxes you see in the club stores like BJ's and Costco's. I was really impressed with her speech, and a lot of it is about innovation and thinking ahead and where the market is going, and experimentation on a constant basis to open up new markets. So.
Thank you, Lisa.
Good morning, everybody. My name is Ray Moya. I'm the COO, CTO, and everything ABCDFG for Argent Associates and its affiliate companies. We're really 4 companies in one. We actually Betty started the company back 15 years ago as a supply chain company managing inventory for companies like AT&T, Verizon, and Sprint. And we've gotten into technology deployments. We're in mobility now. We have a whole division focused on mobility solutions. We have a software company that actually does platform development for global supply chains. And we have another group that basically does all the sustainability requirements. The thing that Barbara talked about was really the whole global. It is a global business. Every business is a global business. And we started out of New Jersey. We're in 7 states today. We're in Canada. We are in Mexico. We're kind of threading the Asian Pacific Rim. So it is, business is global, and that's just the nature of the beast.
I'm Dave Lewis. I am the president of R4 Incorporated. My business partner and I, Scott Crockett, unfortunately can't make it here today. We're former warfighters. He is a 30-year veteran. I am a 20-year veteran from the United States Army. We both retired as senior non-commissioned officers out of Fort Monmouth, New Jersey, our last duty stations. But over the course of my 20-year career and his 30-year career, we deployed in probably every major conflict in that period. And one lesson we learned through all of those different deployments was that manufacturers of equipment that was responsible for our survivability had a concept. There was a mold, there was a formula. And you followed this acquisition formula, and at the end of that rainbow, a warfighter would receive a technology that was there to either defeat the enemy or increase your percentage of survivability, your survivability rate. When we retired, we decided to break that mold, or at least crack it a little bit, and fast forward the acquisition process. So we partnered with a lot of technology providers, manufacturers, to re-engineer a lot of their products from the conceptual stage, white paper stage. And it was different in our industry. We focused on counter-ID technologies that would either detonate a roadside bomb before warfighters would get in the area, or jam the signal to detonate the bomb, allowing our route-clearing missions to drive through those areas safely. We focused on those technologies specifically, and we carved ourselves a little niche and grew a reputation. We're about 6 years old now, but we've had serious rapid growth in our industry. And one of the main sort of business models that we followed was embedding with warfighters. And it resonated with her speech earlier about staying ahead of those consumer requests and trends, that forward-thinking approach. It's really a model that we've adopted in R4 by staying very close to the customer, identifying those customer needs, and then articulating that trend for the customer. It's helped us grow in our company.
Thank you, David. Okay, think about it for a moment. Based upon the shifting markets and the demographics in your industry, do you think you're looking at corporate evolution or actually revolution in order to sustain growth? How about, Lisa, would you like to start?
I definitely identify more with evolution. Our business is going to be 70 years old. It started as a folding carton company making small boxes. We became a toy box manufacturer, and then the toy industry left this country in the 1970s and went to China, and we got into housewares and hardware industry, and we were making boxes for them. And in the 80s, that left this country and went to Mexico and China. And so we started to develop business in high tech and software, and that went to China. And so what's left is basically food and beverage, and now e-commerce, which is another area that's growing so fast. And so we've gotten more involved in the food and beverage industry. That's now 80% of our business. So it's definitely evolution for us, and listening to our customers and what their needs are and what the new technology is.
Okay. And I think we can stay seated. But Lisa, for a moment, you're in a family business. You're a third-generation family business, and oftentimes people say that it's harder to innovate in a family business. Can you share a little bit about how your family business innovates?
Well, for me, my father was really supportive, so that was easy. Unfortunately, his dad died when he was young, so he grew the business from his early 30s into his 60s, and then was happy to hand over the reins to us. And you know, we got involved with lean manufacturing. When a printing press runs at 14,000 sheets an hour, and the press 10 years ago ran at 6,000 sheets an hour, you need to keep up with the technology.
Okay.
So we were able to do that.
Thank you. Okay. Ken?
Okay. I may qualify my answer in that I think healthcare as an industry has been more of an evolution. However, I think with the economy that we're in, we're more of in a revolution stage, although I'm not so sure if all the constituents exactly understand that we are in a revolution period in terms of the changes that are occurring in healthcare. At Somerset, every other year, we recognize our physicians that have given more than 30 years of service to the medical center. And so when we have this event, I'd like to go back to the annual reports from the year that they joined the medical center staff, just to kind of get a feel for what was the thought and what was going on at Somerset 30 years ago from that date. And I remember a couple of years ago, the annual report was probably 1963, 1964, right before Medicare was passed. And I remember the comments from the president at that time saying that we've got to stop this government takeover of healthcare with this system they call Medicare. And so even for as far as you can remember, people are afraid of change. And Medicare hasn't killed the healthcare industry. If anything, it's been a great addition to the healthcare industry. So the changes that we're undergoing now as an industry, I don't fear the change. The change is necessary. Right now, healthcare is about 18% of the national GDP. The growth rate is unsustainable. Everybody in this room that provides benefits to your employees struggle with the cost of those benefits and the rising cost of those benefits. And so that cost curve, it's not good for corporations, it's not good for the healthcare industry because it's not sustainable. So I see a couple shifts that have already started that are really going to change the landscape of healthcare. One thing is I don't know that our patients or the population is going to have the loyalty to their providers that they used to have years ago. I used to hear physicians saying, I don't care what you do or what you say, those are my patients and they're going to go where I tell them to go. But now with the economy, you're starting to see some radical shifts in the cost of copays, the cost of deductibles. I remember the day when there was a $2 copay. Nowadays it's not uncommon to have a $50 copay to go see your primary care or a $100 copay to come to an emergency room and to have a $5,000 deductible. So patients are much more conscious about where am I going to go for my care because much more of that cost is on their back these days. In terms of how we're being reimbursed, our reimbursement system up until the last couple of years was really predicated on a volume model, not necessarily a value model. So the more volume that we saw, the more revenue we had. Now those reimbursement models are starting to shift in that we're being either incentivized or penalized for not just treating the patient, but for the outcomes of those patients. So if we don't have a good outcome as against national benchmarks, we actually are penalized. The other thing where we're starting to see penalties is treating patients in the wrong care setting. So what I mean by that is if a patient comes into our emergency room and we admit that patient, but that patient really could have been treated and released from the emergency room, we will get denied that admission payment. And so the incentives are starting to be aligned to keep patients out of the hospital, and that's where my world is radically changing. Is my industry was built on a hospital campus and very expensive care, and it's shifting more towards outpatient, where the cost of the setting is less, the cost of care is less, but patients don't necessarily need to be in an emergency room, for aftercare hours or minor acute illnesses, or they don't have a primary care. So again, I see a lot of shifts in my industry that are occurring overnight, and that's where I think those that don't recognize the shift will struggle once that curve has been fully met.
Yeah, just even thinking about some of the apps that are available now, if I don't take my pill in the morning, my telephone will tell me, have you taken your pill yet? So there's an amazing amount of changes. Ray?
By the way, your facility is very nice. I've been there, very professional. I love the experience. Not that I want to go back, mind you, but it's a very nice experience. I think all businesses are evolutionary until you get to the point that you recognize that you have to make a significant disruptive change. And I think that Betty epitomizes that. Her thing is about disruption, changing the way the customer experience feels. When we first started this business, we were basically just shipping boxes. And all of a sudden, we started saying, okay, how do we change this space? We made it more simple so that it's, 3 clicks and you're out, right? So it's disruptive, right? Companies, particularly large companies, it takes a lot of processing, a lot of steps to get through. And we said, no, we want to change that. 3 clicks and you're done, right? So we re-engineer our processes and our systems to make it 3 clicks and you're done. In terms of our global experience, we recognize that, it's a little bit more than just placing a purchase order and getting a box from A to B. It's a whole experience of what kind of box is it? Can it sustain, the environment that it needs to be so that when you get from A to Z, it still works, it's still a functioning unit, or it's still a viable product? Because, we lose products in the process for any number of reasons. Temperature change, staying too long in one location, those types of things. So we made an investment in this company, Sea Control in California. So we introduced the technologies in our shipments so that we can track and monitor and see what's going on within our supply chain and our products. So, so our customers get a warm and comfortable feeling that it's not just, it's almost like the medical field, right? You look at your phone and say, oh, by the way, you forgot your pills, right? I want to be able to look at my phone and say, okay, my shipment was late, or the temperature changed that damaged my product, right? That kind of information. So it's again, it's different, it's a new experience, and we think that by doing these types of things, we want to change the experience and change it for the customer to the better, and that's what I call disruptive, which really, hey, it's a different experience. And I think Steve Jobs did that really well, that he changed the way we manage information. He changed how we consume information, and it's the kind of same type of thing that we adopt within our business strategy.
Okay. Thank you. I can remember I used to live in Argentina, and some of the boxes that I actually got, it looked like I needed some help getting them, and it may be a stronger box. So it's nice to see that we've got that technology now. Dave?
Well, the Department of Defense and Department of Homeland Security, the regulatory infrastructure and framework prevents revolution. And rightfully so, right? The risk is extremely great. So you're not going to revolutionize any aspect of that industry because if your revolution goes wrong, lives are lost, right? So it makes sense that you evolve in this type of industry. But your question got me to thinking about what business is revolutionary. If we really think about revolution and its definition and its application to business, kids in Silicon Valley that produce products that allow us to manage information differently is a revolutionary event. When we go throughout our history, there are key milestones of revolutionary technologies, events, and processes that help us do things differently. And then the peripheral from that activity is an evolution process that you incorporate. And that's what happens in DOD and Department of Homeland Security, where you will see something revolutionary, like your ability to communicate with your peers as you're bored with what I'm saying in your laps, right? So that the ability to do that is revolutionary. Its application in our industry is an evolution. And I think that's true with almost every business. So unless your business is to create something that has never been created before, to help you do something differently or that you had never had the capability to do before, then your business evolves as a result of that revolutionary technology or event or process. So from my perspective, the key is, how do you as a business owner evolve in your industry to stay ahead of those trends or anticipate those trends using the revolutionary processes or technologies that are available to you. And I think when we focus on that as an organization, we implement through our policies the manner in which we communicate internally to the company an expectation from the culture of our company and our employees to embrace it. And that allows us to evolve and push us a little ahead so we can lean a little bit forward from that perspective. So in our industry, it's an evolution.
Thank you. Okay, project forward 1 year from today, and think about what you think is going to be the most notable change in your industry, in your company, something you really want to accomplish, and then some of the challenges that you might have in accomplishing that. Ray, you want to take that first?
Wow, that's a good one. A year from now, I would profess that we're going to see real-time information becoming quicker. It's going to be to me, the analytics is going to be the key to our success, I think, in the next couple of years. I'll take the same example. I'm moving a box, right, from A to Z, but there's different processes within that. And I have to be able to say, okay, I'm looking at forecast, I'm looking at inventory, I'm looking at the hit rate, the churn, I'm looking at construction programs, and I have to be able to take all that information and decipher it in a way that allows me to almost predict what the next couple of weeks is going to look like. So within the next year, our challenge is going to be to take all this information and decipher it and synthesize it in a way that I can really see a couple of maybe 3-4 weeks ahead with a certain degree of accuracy, more like 95% accuracy, that I'm able to see that. And I think that it's going to allow us to become extremely much more efficient, extremely much more valuable to our customers, because we have the ability to have that sense of bringing all these things together in a way that makes sense and allows us to make the right decisions. So next year, I know it's about analytics for us.
Well, you make a very important point. If you think about analytics today, I'm sure that most of you just get reams and reams of paper or computer sheets where you have all this analytical information, but the most important step is, what do you do with it? And when we have all this information, it's growing and growing and growing. Do you have any tips for making sure you analyze it properly for marketable or actionable results?
Yes, take a lot of sample data.
Take a lot of sample data?
Because you just can't look at it once a week. It's basically every couple, 2 or 3 times a day you got to look at the data because things are moving so quickly. Products are moving from Mexico to United States, from China, United States, Canada. You look at all these things and you got to look at them and every couple of hours to make sure that nothing changes. And by the way, the same thing too is that the reason for the GPS technology in shipments is that people steal things. You may find it hard to believe, but people actually steal things. Containers disappear for one reason or another, and our ability to capture that in real time is important because we can prevent products from disappearing.
Huh, okay, thank you. Ken?
Okay, a couple things as I look 1 year out and a little bit further. I think there's going to be much more of a presence of technology that's going to impact us. Site of service is going to impact us, and physician integration is going to impact us. So as I look at technology, you know, I read an article last year about Kaiser Permanente, who's a large, probably one of the largest providers in the country, predominantly out in California and throughout the South. And they said that in 2011, they treated over 5 million patients and never touched that patient. These were virtual treatments. And they did it by email, they did it by telephone, they did it by telemedicine. And I shared this with the medical staff because I said, this is what's coming our way. You know, the traditional way of practicing medicine is changing. And we've had this conversation about telemedicine for neurology. When a stroke patient comes in, time to treatment, time to TPA is critical in terms of, you know, minimizing brain damage. And so, you know, I think telemedicine for that, you know, for that technology is great, that if rather than having to wait for your neurologist to come in 15, 20 minutes, you can just bring up a computer bedside and have an online neurologist immediately with an ER physician, you know, diagnose, treat, and administer TPA. The process can start 15, 20, 30 minutes faster. So technology, I think, is going to play a big part in medicine. Site of service, as I mentioned, our business is starting to figure out how do we keep people out of the hospital, which sounds counterintuitive to a hospital. But nevertheless, there's two situations that we're facing. One is that the cost of healthcare in a hospital is very costly because of the technology that we have to house in a hospital is very costly. The labor in a hospital is very costly. But as an example, we're in the process of building an urgent care center. It's actually our first urgent care center in Hillsborough. So those of you that are familiar with 206, it's a couple hundred feet from the corner of Raider Boulevard. And the reason that we chose that spot was because, again, those of you in the area know that Princeton Medical Center moved their facility out of Princeton into Plainsboro. So there's a huge gap for the people that live in southern Hillsborough, Belmead, Montgomery, Skillman, to have to decide, do I go all the way into Somerville or do I go all the way out to Plainsboro for perhaps care that I may not need an emergency room because it may be after hours, it may be your kid fell in a ball field and hurt himself. Well, that's where I think urgent care centers are going to start to shape how primary care and not emergent care, but urgent care is delivered. So imagine this conversation in front of my active staff about a year ago, which is, you know, our medical staff, when I said to them, you know, from my opinion, my humble opinion, I think the day of a solo practitioner hanging a shingle on Main Street is going to disappear overnight. Because the cost, the regulations, the technology that they have to keep up with is going to be too burdensome for the small practitioner to survive. For the consumer, they no longer want to call a physician and say, well, I can get you in 2 days from now or 3 days from now or maybe even longer. So urgent care centers are modeled where we will staff them with our ER physicians. So, you know, you will have an ER physician in an urgent care center, but there's no appointment necessary. They're extended hours. They're 7 days a week. And so consumers want choice. They want flexibility. They want convenience. That's not to say that people aren't going to end up in our emergency room, but certainly there needs to be a lower cost setting for the person that says, it's 7 o'clock at night, I don't feel like waiting 2 or 3 hours in an emergency room, I can just go to the urgent care center and be seen. So I think site of service is going to be a big shift in trying to keep people you know, out of the hospital. And there was a third one that I had mentioned, which slipped my mind, but so I said technology, site of service. I'll come up with the other one. Anyway, some of the barriers or the challenges are going to be the cost of capital, because now we're basically having to invest millions of dollars into new facilities, which are going to have the challenge of funding those new facilities as well as the cash flow of those startup operations. So we're in an environment where credit is not what it was. When we financed our expansion back in 2003, we borrowed $83 million. And I couldn't believe how easy it was to borrow $83 million. Today, try and go out and borrow $83 million. So again, capital has tightened up quite a bit, and access to capital is going to be a challenge to be able to make that transition. So those are our challenges.
Yeah, not $83 million. Just try to refinance your mortgage and figure out all the things that you need to do.
Well, the ironic thing back then was when we went out into the market to sell $83 million of bonds, there was a bidding war to get the bonds. We were oversubscribed. We had to go back in, lower the interest rate until we got to a price point. And again, today the market has changed dramatically for access to capital.
Okay. I had read that in New Jersey we have more solo practitioners than any other part of the country. Is that true, Ken?
That probably is true. New Jersey, on the healthcare side, has probably lagged behind a lot of the other parts of the country in terms of how many facilities we have, how many solo practitioners. And again, I think that's going to change. And actually, that was the third point that I brought up, was integration of our physicians. We're starting to see more and more physicians that want to be employed by the medical center. We had a consultant back in November that said in 2012, across the nation, it was the first time that across the nation more than 50% of physicians are employed by a medical facility. Now in New Jersey, it's almost the opposite. It's very few physicians, and they're starting to come on board. But in order to be able to align our incentives with their incentives, we're going to have probably more of that model of employment, because the incentives aren't aligned. Right now, if a patient gets admitted by the physician and they weren't medically necessary to be admitted, I get penalized and I don't get paid, but the physician gets paid to round on that patient. So the incentives aren't aligned. So until we figure out how to align the incentives, this change is also going to be complicated.
Okay. Dave?
Well, for us, a year out really is determined by location. I know that sounds odd, but for R4, internal to R4, we're planning for the Northeast United States, the Pacific Rim, Northern Africa, and the Middle East. We set up an office in Burkina Faso and in Uganda 2 years ago because of AQIM. And now, because of that move, we see expansion. So for us,
I'm sorry, QIM, did you say?
I'm sorry, Al-Qaeda in Maghreb, the Al-Qaeda in Mali, it's on the news now.
Okay.
Right,
Okay.
2 years ago, the United States needed a way to surveil what was going on, and we created what's called an intelligence surveillance and reconnaissance platform to take pictures of bad guys doing bad things 2 years ago. So how is that relevant to what we're going to do a year from now in Northern Africa? The countries themselves, the movement from the State Department is the same abroad as it is here at home. So if the Somerset County Police Department wanted to incorporate a technology that would help fight gang warfare, right? They would not be able to afford it. Well, neither can the country of Burkina Faso. So United States can afford to develop technologies and implement systems that can help it surveil at a macro level. But individual organizations cannot. So how do you take the technologies, the processes, the concept of operations from those large programs and downscale them into a capability for a local police force here or a country that can't afford it? And in our industry, the companies that haven't recognized that will go away.
Okay.
And the companies that do will be ahead of that curve. And for us, that means, because our company philosophy is to embed in the location that you support, for us, that means 4 years ago, we received the award for the fastest growing company here in New Jersey in our area because we won the state of New Jersey primary training contract. We're the prime contractors for the state of New Jersey. We've trained over 1,500 first responders here in New Jersey. City of Boston, New York, counter ID, concept of operations and planning tools were developed by R4. I'm getting a little bit off track here, and I think I should not. Just to get a little closer to the point, we must be able to take large programs, downscale them to organizations that can afford it, whether it is a Department of Homeland Security, a local municipality organization, or abroad, a country that normally cannot afford it, and provide those solutions so they can help themselves, as opposed to the Department of Defense planning a footprint in that area to help.
Okay. And I've read actually that a lot of innovation is now coming from other countries, where sometimes we start out and we have an enormous budget and do top of the line, and then another country like China can innovate and provide us back with something. Like I even read about MRI machines. We've gotten a lot of innovations from other countries. Thank you, Dave. Lisa?
Well, for me, I guess the best way to illustrate, the change and how rapid it's been is my dad is 83 years old, and he still comes to the office when he's very healthy, and he comes to the office and walks through the plant. He loves to see the machinery, and we're an old-fashioned manufacturing company, except the technologies have changed so much. And a couple of weeks ago, we bought a $4 million die cutter about a year ago, and my dad walked out in the plant and the machine wasn't running, and he asked someone, why isn't the machine running? Oh, it's down, it's broken. And he came, running in to the office. Why isn't anybody working on that machine? Why isn't anyone fixing that machine? And I took him over to the kitchen, and there was the technician from BOPS sitting in the kitchen with a laptop fixing the machine. And for my father, that was something that was just, he could not understand why there weren't 8 mechanics on that machine. And that's, the way the technology has changed. Everything is computerized now, and will continue to be. And so that you have to have the abilities and technologies and software to be able to keep up with that.
Thank you. I have a couple more prepared questions, but I also want to make sure that if anyone has burning questions in the room, that they have the opportunity to ask them. At this point, does anyone have a question? Oh, over here.
Stephen from Genways. My question is to Ken regarding technology and medical practice. Especially genomics. With advance in genomics, the amount of information, the quality of information available to the doctor, to the patient, is going to have huge impact. I'm wondering at Summit Medical, is this a boardroom conversation? Is there a corporate strategy to pull the technology or to follow? Or you leave this to individual doctor and association to make decision?
Actually, if you don't mind, I think on their next question, I'm going to touch on technology, so I'll probably be answering most of that with my next comment.
Okay, well then let's go on to that next question and start with Ken. What's been your company's most successful business model innovation over the last 2 years?
Okay, that was a good lead-in. We're not an inventor of technology, but I would say the thing that we're most proud of is our IT platform. As a community hospital, I think that we've always been a little more cutting edge. Again, for those of you that are from Somerset County and are familiar with the Steeplechase Cancer Center, when we opened that facility, we purchased a linear accelerator that does radiation treatment that had rapid arc technology. It was the fastest treatment on the market. Most radiation treatments are 15 to 20 minutes. This provides treatment in about 1.5 minutes. And so again, when you think about minimization to tissue organ damage, this technology was so advanced, the only other hospital in the country that had it was Duke University, and we had to bring their physicist up to set the machine up and calibrate it. That's how advanced this technology was. A couple years ago, we entered into robotic surgery. So again, for a community hospital, I'm pretty proud of the advanced technology that we can offer the community. But in terms of the past 2 years, I would say it's been our IT platform. When I was the CFO back in the early 2000s, the CIO reported to me, and at that time, we had 14 legacy systems that none of them talked to each other. Half of them, should have been shelved years earlier. And so we had to make a decision on a technology platform to move the organization forward. So we looked at all the major players in that space, and we went with a company called Cerner. And the reason we selected it was because they had built their database from the ground up. So it wasn't a bunch of purchased companies that they just interfaced. This was truly a brand new database that, whether it was the radiology department, the lab department, registration, everything fed into one single database. And so we thought that's really, the future of our platform to be able to build off of. And I told the CIO at the time, this is either going to be the best decision or the quickest career we've ever had, because we had to replace 14 clinical systems, and rather than do it one at a time, which would have taken several years, we decided to replace all 14 systems within a 10-month window. So it was a daring decision, and again, when you think about it as being corporate leaders, sometimes you've got to kind of step that line and make those decisions that in the long run are going to pay off. Well, roll that forward to today, that technology and platform has been able to have us, a lot of you may have heard about the government with Accountable Care Act, it's called meaningful use. The government wants hospitals to move towards a totally electronic health record. And we do have a totally electronic health record. 2 years ago, and again, this was an interesting conversation in front of the medical staff, where I told them we are going to mandate that you will have to put all your orders in electronically. For those of you that ever seen a physician's handwriting, you'll appreciate why we mandated that all our medication orders have to be entered electronically. But again, it was this platform that gave us the ability to move towards a total electronic health record. So now the industry is starting to reward providers in incentive payments that if you hit, there's 3 stages of meaningful use. If you hit those stages, they will pay you money to be able to implement that technology. We were the second hospital in New Jersey to be able to certify to stage 1 meaningful use. And there was probably at the time only a couple hundred hospitals across the country that were able to attest to stage 1 meaningful use. Right now we're completing stage 2. We've also leveraged that technology to, the state is creating health information exchanges. And so there's an organization called Jersey Health Connect that we were a founding member of. Right now there's 22 hospitals that are a member of Jersey Health Connect, and there's 6 of these health information exchanges throughout New Jersey with the concept of we will all feed our patient data into a common database. So, and then eventually the state will connect the 6 exchanges into one statewide database. And then eventually the state database will be connected into a national database. So similar to an ATM, the goal is that eventually, no matter where you travel, if there's access to the internet, you'll be able to get access to your medical record. And you know, the benefit to the patient is that it will speed up treatment time, because if you're traveling in California and you can access your record from New Jersey, that hospital doesn't have to figure out what tests you've had, you know, what results you've got. They'll be able to just pull it up through these exchanges. That will also improve outcomes, but it'll also help reduce readmissions, because again, they'll be able to see your history if you're not going to your facility that you normally go to. So I think whether it's Summit Medical Group or our physicians or Atlantic participates with this exchange, Robert Wood participates with this exchange. So again, this technology has really given us the platform to start to move towards what many other industries have already done, is how do you access data to improve the product?
Thank you. And we have 7 minutes because I absolutely swore to Pam that I would get the panel off at 10 o'clock. So is there anything that you would like to share before we can open it to a couple more questions? Anything that you haven't been able to share yet?
Well, I brought a little show and tell to talk about innovation and the changing marketplace. And one of the things that's happening, which I'm sure everybody's aware of, is internet shopping and how big it's becoming. And one of the issues for retail is how do you keep your name in front of the customer once they're shopping online, once they're not going into Bloomingdale's? How do you keep that name recognition? You know, it could be anybody that they're shopping with online. So it's actually opened up a market for us that we never had before. And so a package comes, you know, we don't make brown boxes. So a package comes to the customer at their doorstep, and it's a brown box, and they open it up, and how do you identify that that's the customer? So we've developed a new product line. So, you know, you get your brown box, but when you open it, there's the advertisement for the customer. This happens to be Hanky Panky. Women in the audience may know what that is. And so now the customer experience when they open the product is a much finer experience because the brand identity is there. So that for us, that's opened up a whole new market in packaging that didn't exist before the internet. So that's been revolutionary in or evolutionary for us.
Thank you, Lisa. Anything you'd like to share before we open it to questions?
No, I'm fine. One quick point. I think we depend too much on technology for innovation, when I think the greatest innovations we've had in the company was opening up our weekly activities report, our staff meeting, to lower level employees and making it mandatory that they contribute. That minor change got us ahead of sequestration, opened up our foreign military sales business, allowed us to streamline operations here in the States, won us the New Jersey contract. So from a business model perspective and reinventing your business, the technology is beautiful and it's great and it helps you do your job well. But when you focus in on your policy and your processes internal to your organization, I think you find the greatest strides in innovation.
Okay, thank you. Questions?
Hi, I'm MJ Jolda. I'm a consumer packaged goods marketing executive by training. I'm now with Chief Outsiders, working with small to mid-sized businesses on their marketing challenges. So what I'd love to hear from the panel, as a consumer packaged goods marketer, and as Denise had talked about, the culture of the company as well as the processes very much are focused on innovation and renovation. So I'd love to hear from your company, because the definition is different by company and industry, how you approach innovation or process and embedding it in your culture or within your firm.
Okay.
I'll take a stab at it. It's part of the corporate plan. Every year we have a plan. And part of that plan is what are we going to do differently? You know, what technologies we're going to adapt, what do we want to change in the customer experience, in how we manage our business. That's at that time, which is typically on January, when we sit down and look at that.
For us, we fire employees that don't contribute.
Well,
It's a part of our culture, I'm sorry.
I think Dave also said, open it up. I think that's a very important point, that too many times some of the people who are in executive roles feel like they have the answer, and a lot of times someone totally different has the answer. Anything to add?
Go ahead. Just in the healthcare field, our culture has to be about the patient. And so we focus tremendously on our patient satisfaction. And so at all levels, we have a culture of excellence steering committee, and it talks about leadership and education. But really the core is about patient satisfaction, because when the public comes in, they have their situation, and to them, that is the most important situation. And so, like recently with the flu, we've experienced a surge of 60 to 100 patients extra a day in the emergency room, and I have to create that culture where no matter how busy you are, no matter how frustrated people get with you, you still have to focus on the culture is about the patient. And that's difficult, but that's really what we try and embed into the employees.
We have a few different ways. We take lower level employees on shopping trips. So we actually go to Costco's and BJ's and walk around, because they're making the product at the base level. They're thinking about it in a different way than I might be thinking about it, and we've had ideas come out of that. We also have these lunch and learns with our customers like Kellogg's and Pepsi, and we try and get their group of marketing people or innovation people to sit down with us. We talk about what we're thinking about in terms of new equipment, or what we're thinking about in terms of innovation, and then they give us feedback on where their company is headed and what they're thinking about, and that definitely steers us in the direction that our customers want to go.
Okay. Thank you very much. I read an innovative suggestion the other day that I think we should all try to use. It was a person who was talking about the fact that he did a lot of research. They had a lot of research in the article about sedentary lifestyle is our generation's smoking. And that as they look at it more and more, they're saying that as bad as smoking is, our sedentary lifestyle is even worse. So the idea was that instead of us ever meeting for a coffee meeting or just to sit down over lunch, we should all meet and walk. So if it's bad weather, we invite each other to mall walk through something like the Short Hills Mall, or we go to a park and we share our business and ideas that way, and by the end of the year, we'll all have lost 3 pounds. So I thought that was a very innovative way of helping us with our obesity struggles. I want to sincerely thank our panel today. I actually have some plaques for you in appreciation from ACG. We don't have such a nice box as Lisa showed, but I think you'll all enjoy them. So thank you very much.
Thank you.
Thank you.